This video contains a truth that has changed the lives of many people. If you are having health problems and have ever felt stuck, please subscribe to the channel and leave a comment in the comment section so we can share useful knowledge together. Have you ever sat down to rest only to feel that sharp, nagging pain shoot down the back of your leg like your body is sending a lightning bolt from your lower back all the way to your foot? It's not just annoying. It can stop you from enjoying the simplest pleasures, like going for a morning walk, playing with your grandkids, or even just getting a good night's sleep. If you're over 60 and living with sciatica, you're not alone, and more importantly, you don't have to live in pain forever. I've been a physician for over 30 years, and I've seen how sciatica can take a toll not just on your body, but on your spirit. It's exhausting, it's frustrating, and it often feels like no one truly understands how deeply it affects your day-to-day life. But here's the truth: relief is possible. And no, it doesn't always have to come from pills or surgery. In fact, there are several gentle, practical, and effective methods that can bring real, lasting relief, especially for seniors. In this video, we're going to talk about 7 powerful methods to relieve sciatica pain that are especially suited for people over 60. These are things you can start doing right at home, simple steps that work with your body, not against it. My goal is to help you feel stronger, more mobile, and yes, more hopeful. And hey, if you're watching this and you've been battling sciatica or dealing with other health challenges, I want to hear from you. Drop a comment below and tell me what you're going through. This is a safe space, and we're building a community that supports one another. You never know who else might be reading and feeling the same way. So let's dive into the first thing you can do that may bring you real, tangible relief. Let's talk about movement. I know when your back or leg is screaming in pain, the last thing you want to do is get up and move around. But here's the truth: gentle movement can be one of the most powerful ways to relieve pressure on the sciatic nerve. The key word here is gentle. You're not training for a marathon. You're just helping your muscles relax, your joints stay loose, and your nerve pain gradually subside. Something as simple as slow walking for 5 to 10 minutes in the house, maybe from the kitchen to the living room and back, can start to wake up the muscles that support your spine and ease nerve compression. Even better, try gentle stretches you can do while sitting down or holding onto a sturdy chair. Picture this: sitting at the edge of your chair, you slowly cross one ankle over the opposite knee and gently lean forward just a little. You'll feel a nice stretch deep in your hip where the sciatic nerve often gets pinched. Hold it for 20 seconds, then switch sides. That's it. Nothing extreme. Just enough to say to your body, we're working together. If you've been afraid to move because of the pain, I completely understand. But the goal isn't to push through pain. It's to work around it, gently and consistently. The more you move, the more blood flows to the nerve, the more your muscles support your spine, and the less pressure you feel over time. Now let's move into the second method, which might sound too simple to work, but it's one of the most overlooked tools we have: heat therapy. Warmth can do wonders for sciatica, especially if your pain tends to flare up after resting or waking up in the morning. That aching, stiff sensation you feel when you try to stand up after sitting too long, that's your muscles tightening around the nerve, and warmth helps those muscles relax. A heating pad placed on your lower back for 15 to 20 minutes at a time can bring soothing relief. You can also use a warm towel, or even take a gentle warm bath. Just make sure you're safe getting in and out. If mornings are tough for you, try using heat while you sip your coffee or read the paper. Let your body warm up slowly. No rush, no strain, just gentle kindness toward your own body. Heat helps increase circulation, loosens tense muscles, and creates an environment where healing becomes more possible. And here's the bonus: it also feels comforting. When you're in pain, comfort is not a luxury. It's part of the treatment. But we're not stopping there. Let's talk about something a little less obvious but just as important: posture. I can't tell you how many times I've seen someone's pain improve simply by changing the way they sit or stand. We don't think about posture much until it becomes a problem. But when your spine is out of alignment, even a little, it puts extra pressure on the discs and nerves, including the sciatic nerve. Over time, that pressure builds, and suddenly, You can't walk across the room without that searing pain shooting down your leg. So here's what you can start doing today when you sit. Make sure your feet are flat on the floor. Your knees are level with your hips and your back is supported. Sit upright, not hunched forward, and avoid crossing your legs for long periods. If you're watching TV or reading for an extended time, try placing a small pillow or rolled up towel behind your lower back to keep your spine in a more natural position. Standing posture matters too. Try standing with your weight balanced between both feet. Don't lean on one leg, and try not to slouch. I know old habits are hard to break, especially if you've been standing a certain way your whole life. But small adjustments can lead to big relief, and your body will thank you for it. One of the most powerful things I've learned after 3 decades of treating patients is this: the body wants to heal. It really does. Sometimes we just have to give it the right environment. That starts with movement, warmth, and posture all working together to take the pressure off your nerves and give your body a chance to do what it's naturally meant to do. So now that we've talked about gentle movement, heat therapy, and posture, let's keep going with some other deeply effective techniques that have helped countless people find relief from sciatica, especially later in life. You're still with me, and that tells me something important. It tells me you're not giving up. You're ready to take control of this pain and do what it takes to feel better. That kind of determination, it's powerful. And as we continue this journey together, I want to remind you that even the smallest steps forward can lead to real change. You deserve a body that lets you move freely and live fully. And that's exactly what we're working toward. So let's keep the momentum going. We've talked about movement, heat, and posture, but what if I told you there's another method that can ease sciatica pain? And you don't even have to lift a finger for it. Let's talk about massage therapy. And no, it doesn't mean you need to book an expensive spa treatment or lie down on a massage table for an hour. Gentle massage, even at home, can do wonders for sciatica. When your muscles are tight, especially around the lower back, glutes, and hips, they can clamp down on the sciatic nerve like a vice. Massage helps loosen those tight muscles, increase blood flow, and reduce inflammation around the nerve. You can do this on your own or with a little help. Here's a simple method you can try tonight. Take a tennis ball, lie on your back on a carpet or yoga mat, bend your knees, and place the ball under one side of your lower back or glute area. Gently roll your body side to side, letting the ball massage those deep muscles. If lying on the floor is difficult, try sitting on a firm chair and placing the ball between your lower back and the backrest. Then shift your weight gently to apply pressure. Even 5 minutes a day can bring relief. And if you have a partner or caregiver, ask them to use their hands to gently press and knead the muscles around your lower spine and hips. Don't go too deep. You're not trying to break up anything. Just relax the tissue, invite the muscles to soften, and allow your nervous system to breathe a little easier. Let's move into another incredibly important yet often forgotten part of sciatica relief: hydration and nutrition. Now I know, when we talk about nerve pain, food might not be the first thing that comes to mind, but what we put into our bodies has a massive impact on how much inflammation we carry. And inflammation is one of the biggest culprits behind chronic sciatic pain. When your body is inflamed, the tissues around the nerve swell up, and that swelling squeezes the nerve, amplifying the pain. But here's the good news: what you eat can either fuel the fire or help calm it down. If you're living with sciatica, aim to eat more anti-inflammatory foods. Think colorful fruits like berries, leafy greens like spinach and kale, healthy fats from olive oil or avocados, and omega-3 rich fish like salmon. And just as important, cut back on foods that cause inflammation. That includes processed snacks, sugary drinks, white bread, and fried foods. These might taste good in the moment, but they often leave your body feeling heavier and more inflamed afterward. Hydration is key, too. Your spinal discs, those cushiony pads between your vertebrae, need water to stay healthy and flexible. When you're dehydrated, those discs dry out, shrink, and lose their ability to protect the nerves. So drink water throughout the day. Even if you don't feel thirsty, make it a habit to sip every hour. A hydrated spine is a happy spine. Now let's talk about something that might surprise you: mind-body techniques. I'm talking about breathing, mindfulness, and relaxation, not as a replacement for physical treatment, but as a powerful tool that helps your body calm down from the inside out. When you're in pain, your body naturally tenses up. Your muscles tighten, your breath gets shallow, and your nervous system goes into what I call protection mode. This can make your sciatica worse, not better. So learning how to calm your body and mind is more than just mental. It has a physical effect on your pain. Start simple. Try this right now, wherever you're sitting. Close your eyes, place one hand on your belly, and slowly inhale through your nose for 4 counts. Feel your belly rise. Hold it for a moment, then exhale gently through your mouth for 5 counts. Do this 3 to 5 times. That's it. It only takes a minute, but it sends a powerful signal to your body. We're safe, we can relax. We don't need to stay tense. Over time, deep breathing like this can help lower your pain response, reduce muscle tightness, and even improve sleep, which, let's be honest, is something a lot of people with sciatica struggle with. If you've ever laid awake at night trying to find a comfortable position, while your leg throbbed with pain, you know exactly what I mean. Now, if you're open to it, you might also try guided meditation or gentle music in the evening, something to help your nervous system unwind. There are free apps and videos that guide you step by step. You don't have to be an expert. You just have to be willing to slow down and give your body a chance to reset. These techniques may seem subtle, but they can create a foundation of calm that supports every other method we've talked about. And when your body isn't fighting against itself, healing comes more naturally. You've already made incredible progress just by learning what's possible. Every strategy we've talked about so far builds on the last. Gentle movement loosens the body. Heat soothes it. Posture supports it. Massage relaxes it. Food and water nourish it. And now, the mind helps it find peace. But we're not done yet. There are still a few more tools I want to share with you, practical methods that have helped so many seniors I've worked with reduce their pain and take back control of their lives. So stay with me. You've come this far, and the best part is still ahead. You've made it to this point, and let me tell you, most people don't. They start searching for relief, feel overwhelmed, and give up halfway through. But you stayed with it. You've opened the door to healing, and now it's time to walk through it. Not with fear, not with frustration, but with hope and confidence. Because yes, sciatica pain is real. It's frustrating. It can steal your freedom if you let it. But you are not powerless. In fact, with just a few more steps, you can take back that freedom day by day, moment by moment. Let's talk about stretching. One of the most underrated, but deeply effective ways to manage sciatica. Now, I don't mean bending like a gymnast or trying to touch your toes like you did in your 20s. I'm talking about gentle, controlled stretches that open up the hips, lengthen the spine, and release pressure from the sciatic nerve. One of the simplest and most effective is the seated piriformis stretch. That little muscle, the piriformis, sits right over the sciatic nerve. When it's tight, it can press directly on the nerve and cause pain to shoot down your leg. Here's how you stretch it safely. Sit in a sturdy chair. Place your right ankle on your left knee and gently lean forward with your back straight. You'll feel a stretch in your hip and buttock. Hold it there. Breathe deeply and let the tension melt. Then switch sides. Just 30 seconds on each side, once or twice a day, can make a noticeable difference. Another gentle option is lying on your back with both knees bent. Bring one knee toward your chest and hold it with both hands, breathing slowly. This helps stretch the lower back and glutes to areas that tend to lock up when sciatica flares. Over time, stretching helps increase flexibility, reduce compression, and restore movement. But listen, stretching isn't about pushing through pain. It's about creating space. If it hurts, stop. If it feels good, keep going. Your body knows the difference, and trust me, it will thank you. Now, let's turn to something a little more high-tech, but still easy to use: TENS therapy, or transcutaneous electrical nerve stimulation. It sounds fancy, but it's actually a small device about the size of your hand that sends gentle electrical pulses through sticky pads placed on your skin. These pulses help distract your nervous system and block pain signals from reaching your brain. Many seniors I've worked with swear by their TENS units. They use them while sitting in a recliner, watching TV, or even before bed. You just attach the pads to the lower back or glute area where the pain starts, turn the unit on, and let it do its thing. It doesn't hurt, it just feels like a soft buzzing or tapping. And best of all, it's non-invasive and drug-free. You can find affordable units online or at your local pharmacy, and many are user-friendly, with clear instructions. If you're unsure how to place the pads, your doctor, physical therapist, or even some YouTube tutorials can walk you through it. It's a great tool to have in your pain relief toolbox, especially on days when your body just won't cooperate. Let's not forget rest matters too. I'm not talking about lying down all day, but intentional rest, giving your body permission to recover. Sometimes when we're in pain, we feel guilty for not doing enough. But rest isn't laziness, it's part of the healing process, especially for seniors, whose bodies may take longer to repair soft tissues and calm irritated nerves. That might mean taking a short nap after a walk, or lying down with a pillow under your knees to relieve pressure on your spine, or simply sitting quietly with a warm cup of tea, eyes closed, no distractions. These small pauses matter. They give your nervous system a break from the constant stimulation of the day and allow your body to reset. Now, before we wrap this up, I want to leave you with something that goes deeper than any stretch, massage, or device your mindset. I've worked with patients for over 30 years, and I can tell you, the ones who find relief, who live well despite their pain, all have one thing in common. They believe healing is possible, and that belief, it's powerful. When you believe there's hope, you stay consistent. You take small steps, even on hard days. You speak kindly to yourself, instead of thinking, this is just what getting old feels like. Because pain doesn't mean you're broken. It means your body is asking for attention, for care, for patience. And when you give it that bit by bit, it responds. You don't have to do everything at once. Maybe today, you start with a few stretches before bed. Tomorrow, you drink a little more water. The day after that, you try a short breathing exercise. And slowly, steadily, you'll start to feel a shift. Maybe the pain won't vanish overnight, but it becomes softer, more manageable. Your sleep gets a little better. Your mood lifts. And before you know it, you're moving more freely again. So here's what I want you to remember. You are not alone in this. You are not helpless. And you are certainly not done growing, healing, or living fully, no matter your age. Now, I'd love to hear from you. If you're living with sciatica, tell me in the comments what has helped you the most. What's been your biggest struggle? I read every comment, and your story might just be the encouragement someone else needs to keep going. And if this video helped you, please give it a thumbs up and hit that subscribe button. We've got more practical, down-to-earth health tips coming your way, and I don't want you to miss a thing. We're building a community here, one where seniors are supported, seen, and empowered to take control of their health. Here's to more movement, less pain, and a future filled with possibilities. You've got this, and I'm with you every step of the way.